As you know, we are My One Health, and for those who are not aware of what we do, I'd like to explain, maybe make you more familiar. We are a medical platform, as you can see. We help patients to access specialized medical care globally, not only in Kenya or Africa, but around the world. So we have a few guest speakers today for the webinar, as we are focusing on the male's health this November. We have Dr. Eric Mutiso, who is a urologist and a general surgeon. We also have Dr. Mutua, who works with CA Medilinks as a general doctor, and I'll give them time to introduce themselves. And we have Ms. Hamida, who is psychological counseling specialist and works with Tulivu Psychological Center. So as I have introduced them, we will give them time to each take us through their presentations, and we will as well have a Q&A session at the end of it. And feel free to ask all the questions you may be having and learn as much as you can. So just to give you an itinerary of how we're going to take this through, we're going to start with Dr. Mutiso, and then we will go to Dr. Hamida, and then Dr. Mutua. I'm so excited about this session. I hope you all are, male or female. There's something to learn and take home from here. So I'll give Dr. Mutiso the floor to open up. My name is Libby. I work with My One Health. I deal with the regional area, meaning the Africa area, where we assist patients to get specialized healthcare. So Dr. Mutiso, thank you for taking your time out to join us. I think I will leave the floor to you and just take it away. Right.
Hello, good afternoon. I hope I can be heard.
Dr. Mutiso, you are on mute. Kindly unmute on your side so that we can hear you.
Hello, can you hear me?
Not yet. We still cannot hear you. Okay. Can you hear him? Anyone? You can just raise your hand in the chat. All right. So okay. Thank you.
Okay, you can just inform me in case of any issues. Yes, my name is Dr. Eric Mutiso. I am a general surgeon and a urologist. Today I'm going to be talking about men's urological conditions, generally urological health. So what are the most common conditions that affect men urologically? I'll talk the three most common ones that in our region are issues to do with the prostate, which now today I will discuss, give a good overview about it. And the other conditions that are also common in our region are stone diseases, which affect both male and female, and also sexual dysfunctions. These are the erectile dysfunctions, and premature ejaculation, and such. So for today, I will limit my talk to what is most common in our region, which is prostate condition. So let me start by, maybe you could put up the second slide. It's possible. What is the prostate? Sorry, I can continue.
Speaking. Yes. It's okay, you can carry on, Dr. Mutiso. We will send the images as you are doing your presentation.
Okay, so just a quick overview. What is the prostate gland? This is a gland that is, of course, unique to men. It's only in men, and it is located just below the bladder, just where the what we call the urethra, the outlet of the urine is. So it's just below the bladder, And this prostate is its main function in the human body, the male body, is to it produces part of the semen, that is the liquid part of the ejaculate. And this semen is meant to protect the sperm, give sperm nutrition, and all the capabilities that will enable it to travel all the way to fertilization. So it's a very important gland. Now, this gland is under the action of the testosterone hormone, which is the male sexual hormone. And as such, as from the age of 40 years, every man will have at least an enlargement of this prostate gland. Just because you've reached at least the middle age, there will be some enlargement. So that brings us to the condition which we call benign prostate enlargement. That is an enlargement of the prostate gland. We call it benign because it has no cancer in it. And the other condition will be prostatic cancer, that is cancer of the prostate. So as we've discussed, it starts from middle age, on average from 45, 50 years going forward. So what happens is the prostate enlarges and compresses on the outflow of urine from the bladder. So what are these signs that you get? Well, can you know that your prostate is enlarged? So these are usually symptoms that you feel that are associated with your urination. You'll find you're going to the toilet far much more often than before. We call that frequency. You find that the urine stream has less power or strength as compared to before. You find you have what we call urgency. You are unable to hold your urine until you reach the toilet. There's always some dribbling. And also another symptom would be, we call it nocturia, is waking up at night. From the time you go to sleep, the time you wake up more than one time at night. So let's say two or more times at night, that means that's nocturia, to go to urinate. So these are the symptoms that will give you an indication that you are having a prostate issue. Now, for prostatic cancer, it presents almost the same way, the same urinary issues, but there might be some additional symptoms because the cancer might have spread. So cancer of the prostate usually spreads to the bones, like the backbone. So you can find a patient presenting with severe back pain associated with urinary problems. But on average, there's no distinguishing symptom between the benign prostate enlargement and cancer. They might present the same. The only thing is that benign prostate enlargement is far much more common than prostate cancer. Prostate cancer presents far much later in the 6th, 7th decade of life, while benign prostate enlargement can come from around 50 years. So what happens when you get the symptoms and you visit the urologist? When you come to us, our main issue, what will be done is that our evaluation, which usually relies on three things. We examine you usually through what we call digital examination through the rectum to assess the prostate. Also, there is what we test. I'm sure you heard of the PSA. This is a prostate-specific antigen. This antigen, this enzyme is only found in the prostate gland. So it is specific to the prostate. Yes, as you can see the diagram there, that's just an outline of how it looks. You can see where the prostate is. So any enlargement will obstruct, like the second slide, please. Any enlargement will compress on the outflow. Okay. So what happens when you come to the urologist is what I was discussing. So there's a blood test, the PSA, our examination, and also ultrasound. An ultrasound is done to assess the prostate and the kidneys. So at the urologist, our main thing is to differentiate, to first confirm that your prostate is enlarged. Okay, There might be other conditions that may mimic, but most common is the prostate enlargement. And also to differentiate between, do you have only prostate enlargement or is there also cancer? So at that point in time, I would like to discuss something about screening, because it's something that is in the public domain, and it is cancer is a very emotional topic for many, especially prostate cancer. So screening, the screening methods that are available, the methods are the PSA and biopsy. If the PSA is raised, we have the normal is usually up to 0 to around 6. If it is raised, then there's a decision on whether to do a biopsy or not. But one thing I would like to stress is that currently in our guidelines in Kenya, according to the National Cancer Guidelines and practice around the world, is that there is no role for mass screening of prostate cancer. So there is no age that we can say at this age, everyone should go for screening. That one is not there. And why is it not there? Number one, because the screening modalities are not 100%, and that there will be some false positives, false negatives. Number two, which is very important also, is that prostate cancer on average, majority of the prostate cancer patients, prostate cancer is a slow developing, slow progressing cancer. There is an adage that has been used from many years, even more than a century, and it's true up to now, that many patients die with prostate cancer, not of prostate cancer. So it is a slow progressing cancer in majority of the patients. It is found usually in the late decades of life. So that if you are to do mass screening, you would sometimes overtreat patients whose cancer not have progressed. Any intervention you make always has some benefits. So that is why we do not have a mass screening. However, we offer to some specific group of people screening. Number one, of course, is the patients we call high-risk patients. Who are these patients? This is any patient from 40 years and above who has a positive family history of confirmed prostate cancer. And this is usually from immediate family, your father, grandfather, an uncle, first-line uncle. If there's a positive history, we advise 2 yearly assessment from the year of 40 years, every year, 1 yearly assessment of the PSA and examination by urologists. The second group are on average patients who are 55 years and above who present with the urinary symptoms that we discussed earlier. This is because, as we said, it is difficult to differentiate BPH and prostatic cancer. So those patients who present with urinary symptoms which look like BPH and they are 55 and above, for those ones we shall offer screening. So that is for the screening process. What does the options which are there? There are very many options in treatment of BPH and also in prostatic cancer. On average, BPH, if those symptoms are not, patients who have BPH or who are confirmed to have BPH, on average, only a third, that is around 33%, require active treatment. The others usually is just observance because their symptoms are mild or none, and their life is not bothered by the enlargement. The other third would be treatments. Most of them use medication, which is used to shrink the prostate. And for those who do not respond to the medication, then we proceed to surgery, where we remove the part that is enlarged. But management of prostate cancer, usually we have, these days in Kenya, we have good setups of oncology, specialized doctors in that area. So I'll not discuss much about it, but there are modalities that are active, currently present in Kenya for prostate cancer. So one other thing I would like to talk about is, which is asked about also, is how can I prevent my prostate from being enlarged or from developing benign prostate enlargement, BPH, or prostate cancer? There's nothing specific for the prostate. It's just like for any other condition. What we advise is on a wellness regimen where you have your good diet, balanced diet, exercise, psychological and physical well-being. In all these situations, you'll find it will either delay the start of this condition or altogether block it, just like in any other condition. But for those who develop BPH, once you develop BPH and you are being observed, you know that you have a large prostate. There are things that you can do in your life that can, in your lifestyle, that can assist you. Some of them are usually in controlling your fluid intake. Do not get dehydrated, but avoid excessive intake. Also, ensure that every time you feel like urinating, and you have the urge to urinate, do not postpone it. Always ensure that you urinated. There is also what we call double emptying, especially for the ones who have this sensation of not completely emptying their bladder. When in the toilet you urinate, you feel you finished, hold on a little and try again to urinate. That's what we call double emptying. And again, mental stress management is very important. So finally, let me talk about the myths, because they're there. These days we have the social media and there are many things flying around. Number one, BPH, benign prostate enlargement and cancer. These two are different conditions occurring in the same organ. One does not cause the other. So the diagnosis of BPH, which is a very common diagnosis in Kenya and around the world, is not an indication that you have cancer. No. There are two conditions occurring in the same organ, not related. The other situation is about the size of the prostate. Many of the patients, they come to us, they've done an ultrasound, they're told the prostate is large, there are grades that we give it, grade 2, grade 3, grade 4, but the size of the prostate does not correlate to the symptoms that the patient has. So regardless of the size of the prostate, if you have those symptoms and there's nothing else wrong, we do not offer management, we just observe. The size of the prostate is important to us if we have initiated management for patients who had symptoms and would like to monitor whether it is reducing or not. The other issue is about, I talked about the management options, they are there. So there are myths that it can never be treated, they are there and they are treatable. Finally, is about the emotional issue that prostate causes sexual dysfunction. Number one, this is not true because prostate issues do not cause, for example, erectile dysfunction. It is true that they can coexist because, as you know, these are conditions that can occur also in the elderly, so they can occur concurrently. But one does not lead to the other. Some medication, yes, and some treatments can cause some forms of ED, but for the majority of patients with benign prostate enlargement, they live to have a good sexual life, and it's not affected by the enlarged prostate. I think that will be all for now, unless there will be questions for anything that I left out or was not clear.